Okay, this is the infant medical scenario. Called to a scene of a 3-month-old with difficulty breathing. Okay, the scene is safe on the outside. PPE is on. I'm going to bring in oxygen because of the difficulty breathing. Okay, get inside. Inside the scene is safe. I'm going to look at the pediatric triangle, the work of breathing, appearance, and the circulation. Okay, work of breathing. The wheezing is you can hear the wheezing. Okay, wheezing. You can hear the wheezing. Okay, child's child is breathing fast and shallow. Okay, appearance. Okay, child isn't awake, but is responsive to pain. Okay, good weight and well cared for. Now at this time, I'm having my partner speak to the parent. I said that the work of breathing with the wheezing and the difficulty breathing was going on for an hour, and it's been getting worse. Okay, child's been lethargic, no allergies, no meds. Um, uh, last eight sample history. Last 2 hours ago. Okay, what happened was mom was cleaning. Child developed difficulty breathing with a non-productive cough. So my partner got that while I'm doing the pediatric triangle. So the work of breathing. Okay, can I notice that the child is wheezing? Breath is fast and shallow. All right. The appearance. Okay. Responsible. Response to pain. Child isn't awake. Okay. Looks good. Okay. Good weight and well cared for. Circulation. You didn't tell us. Okay. Can't really tell. So I'm gonna say at this time, from reading all the other stuff, okay, that the child is cold and clammy, um, delayed capillary refill, okay, and possible cyanosis. So at this time, I'm going to say that the child is in depressed, yeah, respiratory distress, okay, and decompensated shock, if that's possible, to have both things at the same time. He'll let me know. Okay, calling for ALS right away. Okay, because children tend to dive very fast. Okay, because of the because of the wheezing. Okay, the breath being fast and shallow, and the child not being awake and only responsive to painful stimulus. Okay, not awake or verbal. So I'm going to call for ALS and make this a priority transport. Okay, if they can't meet me there in a reasonable amount of time, meet me en route. Okay. No C-spine at this time. Okay, there's no visible bleeding, no life threats. Um, all right. General impression. Okay, priority transport. Child is in respiratory distress and decompensated shock, if that's possible. I don't. You'll let me know. Okay. I'm going to put on a pediatric mask um, with high flow oxygen at 10 to 15 liters per minute. Okay. I'm going to go ahead and transport this child on a short backboard, um, well padded under the body, fill all the voids. Put the head in a neutral position, pad underneath the neck so the head is tilted back a little bit. Okay, and be ready. Uh, the reason for the short backboard is be ready for uh, possibly having to assist with ventilations. So if the child keeps going down, like the mom said, the child is getting worse. If the child, starts to go even down further, and the respiration was at 26, I do believe, 20, yeah, I think it was 20, 26, which is kind of low. If it keeps going down, um, might have to assist with possible bag valve mask. Okay, so already got the child on high flow oxygen. Transported on the backboard, fill all voids around it, head neutral position. Be ready to assist with the ventilations. Um, Going to perform a secondary assessment en route. I want to consult medical control. I think you can only do that in the ambulance. I don't know. But I would like to consult them real fast, maybe even before we started the transport. If we could go ahead and use a small volume nebulizer, because I think the child's having an allergic reaction to the dust. Did I say that before? I don't think so. Okay, allergic reaction to the dust. So if consult medical control, see if they would okay a small volume nebulizer. I think you do have to consult medical control for that. I would take the pulse in the respiration. Okay, the pulse was 160. Yeah, pulse was 160, which is in the normal range. Okay, and the respiration, I think, changed to 28. Yeah, it changed to 28, and the lung sounds remained the same. So the child breathing a little bit faster, but still has that wheezing. Now, how often would I reassess? Supposed to be, two other qualities I would look for. Yeah, I wanted the skin. That's what I needed. I needed the skin, but you didn't tell me that. But the eyes. I would take a look at the eyes and pulse ox. Okay, reassess every 5 minutes, probably less because it's a child. I mean, you want to kind of keep an eye on everything. If the child further has any deterioration, if the child further deteriorates, goes downhill, okay, possible CPR and assist with the ventilation. I think I got almost everything. Okay, the MIST report. Okay, given to the nurse. Okay, the MIST. Okay, 3-month-old female. Mom was dusting. I can't read my writing. Mom was dusting. Child was having difficulty breathing. It's been going on for an hour and getting worse. And it was preceded by a non-productive cough. Okay. The eye, the illness. Okay, slightly lethargic, wheezing without auscultation. Yeah, another word. Okay, the child's harder and harder to wake up. Okay, signs and symptoms, the respiration was 26, fast and shallow. Okay, wheezing in all lung fields. Okay, responsive to pain, has a patent airway. The heart rate was 160, taken at the brachial, strong and regular. No blood pressure, it said UTO. Well, you can't really take blood pressure on the baby because you want to go ahead and judge by the skin color. That's why I want the skin color. Color, temperature, and condition. But UTO, unable to obtain. That's a swag, scientific wild ass guess. Okay, the treatment that I would give the child would be O2, oxygen, and a non-rebreather, and possibly the small volume nebulizer if medical control okayed it. Okay, I didn't have a baby because I don't know what I would do if I had like a baby here. I wouldn't be doing anything to it because I don't have a backboard to secure it to a backboard or a oxygen mask to put oxygen mask on the baby. So did the baby live? I hope so. Okay, so you'll let me know, I hope, what, if I'm right or I'm wrong, or like a famous instructor once said, I would rather have you make the mistakes now than make the mistakes when you had the patient in the ambulance. Okay, that's, that was the child, infant thing, the infant medical scenario. Okay, 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 bye. How do I turn this off?